Good evening, everyone. How are you doing tonight on this beautiful evening, Wednesday, May 6th? This is Brenda Alberg, Kenai Peninsula Borough Information Officer, and joining us tonight is Dan Nelson, our Incident Commander, to provide us updates on the latest COVID-19 response here on the borough. Welcome, Dan.
Evening, Brenda, and good evening, everybody. It certainly is a beautiful day. I hope you're watching us from the back deck or somewhere out of doors tonight. It's certainly been a wonderful week weather-wise, and just a great time to be in Alaska. So, thanks for joining us tonight. I want to go through a little bit of some updates on the COVID-19 pandemic and let you know where we are here on the Kenai Peninsula, and just kind of get you up to date. And remember that. We are taking questions. If you kind of post questions in the comment thread, Brenda will be monitoring that, and we'll try and get to those as we can throughout our broadcast tonight. Our incident management team here at the borough has been still in a supportive position for all of our cities and our hospitals, and really making sure through a lot of things of logistics and making sure that everybody has what they need, and those plans and communication are still going well. We've really scaled back, as have many of our cities, and are just keeping an eye on things and making sure that we have the information that we need, and being able to take care of all of those things as it relates to new developments. So for a case total, so there are 372 cases statewide. Of those 372, 240 cases are recovered, reported as recovered. For the Kenai Peninsula Borough, the case count is still at 22 cases. 17 of those 22 cases have been reported as recovered. So I'll just talk a little bit about the communities and kind of what the distribution is. For Anchor Point, we have 2 cases reported, 4 cases in Homer, 4 in Kenai, 3 in Seward, 6 in Soldotna, and 3 in Sterling. So that brings us to 22 cases. Testing continues. If you have symptoms of COVID, and then there has been a lot of expansion to those lists of symptoms, you can read those on the Department of Health and Social Services website. That's linked at kpboem.com. If you have any of those, contact your healthcare provider or contact your local public health office if you don't have a healthcare provider to arrange testing. I want to address the latest case that was reported on the Kenai Peninsula. That case was an Anchor Point, and the individual that tested positive for COVID-19 passed away. So it was determined that it was a male, about 80 years old. He did have some underlying health conditions, and when he was admitted to the hospital at the South Peninsula Hospital, he did test positive for COVID. That death is included in those statistics, because the disease is listed as one of the causes of death. So they do get included into that count. That patient was also originally transported by our EMS officials at Anchor Point Fire and Emergency Services. So I want to address that and let folks know that, of course, all of our personnel were wearing all of their recommended personal protective equipment and adhered to all of the protocols that we have in place for response to COVID-19, from having their own personal protective equipment to making sure that the ambulance that was used and all of the tools and other supplies that were not disposable were properly decontaminated. All the apparatus was cleaned up. So we certainly really want to convey our condolences on behalf of Anchor Point Fire and the entire Kenai Peninsula Borough, our condolences to the family and to the community of Anchor Point as they mourn the passing of their loved ones. So I wanted to address that and kind of talk about why that individual is included in those statistics, and let everybody know that we take public safety and things very seriously as far as our first responders, and they have taken all the precautions as recommended through our current CDC guidance and that of our sponsoring medical physician. So that is a brief update on the IMT activities today, and I think that catches everybody up from our conversation last week.
Thank you for that information, Dan. Just for a point of clarification for those folks that don't know what it means to decontaminate an ambulance, or the guidance that has been recommended through CDC or even our medical director here on the peninsula, can you share a little bit about what
So when we talk about decontamination and looking at those things, so if anybody's ever seen an ambulance or been in one, of course, there's a compartment in the back, the box sometimes as we call it, where we provide medical care. And so after each and every medical call, one of the protocols is to decontaminate and disinfect all of the surfaces of that ambulance. So in addition to, of course, things like changing out the linens and all of those things that you might see in a hospital setting, all of the surfaces that are touched, all of the tools, for instance, the monitor that's used perhaps to look at heart rhythms and those things, anything that is not a disposable supply gets decontaminated. Make sure that we disinfect every surface, that we clean that thoroughly, and of course, that is to prevent the transmission of any germs or bacteria or anything else in the healthcare setting. Very similar to, again, what you would see potentially in a hospital room. CDC guidelines has given us some additional criteria to look at, and just being a little bit more thorough in this age of COVID-19. We've been doing a lot of those same things with chemicals and with other types of strong decontamination products that we have. But all of our fire and ambulance service areas have been really taking extra time and being able to do that very, very thoroughly. So when we talk about decontamination, that's what we're looking at. We decontaminate our units at the hospital after we transfer a patient to the care of the emergency department. So that ambulance is completely cleaned and decontaminated before it actually comes back into any of our facilities. Again, another vector to prevent any transmission or inadvertent contamination. We've also done some additional things really since this started as well. For example, oftentimes that patient compartment was connected to the front of the ambulance. That's been sealed off to prevent any contamination. We're using additional personal protective equipment that's donned and doffed appropriately and disposed of. So we're trying to take every precaution, not only for our responders, but also, of course, for the public and the patients we serve.
With regards to our first responders that were involved in this transport, can you tell us a little bit about their exposure or the precautions that they're taking?
So, of course, there was a potential exposure since we know that the patient they cared for did test positive for COVID. Again, all of our EMS responders followed all of the protocols available to them and had their personal protective equipment on. So again, we also do as we doff our PPE at the end of a patient care, we wash our hands and also do other things just for our own personal cleanliness. And of course, again, after we do our decontamination process. So it is, certainly very likely. It's not a zero chance, of course, but since we did have all our PPE on, we hope that our responders are protected from any type of exposure. But working through our medical physician sponsor. And for everybody that's not familiar, we do have a medical doctor that is essentially what we call our physician sponsor for our EMS areas. We work through him, and he gives us the protocols and things for treatment of all types of patients and all the patient care aspects, but also advises us on these types of issues. And because that PPE was in place, the responders that were on that crew were self-monitoring and have protocols in place to report anything unusual to the physician, so we can follow up with that. So I actually talked to one of them today and joked a little bit, said, well, I'm watching every cough and making sure that all of those folks are kind of being careful around families and practicing good hygiene at home, monitoring for any symptoms, and then we'll go from there. So we certainly wish them that recovery. And it is one of the first things that any EMS provider or healthcare provider is taught, is for their own safety, to make sure that we can be safe and monitoring, and so that enables us to help others. So certainly thank them for their volunteer service and responding to this and many, many other calls throughout the year, and they'll continue to self-monitor.
Anchor Point is a small community. I would say our entire borough is a small community. We definitely know each other to some degree, from one person to the next. Can you walk us through what's called the contact investigation with regards to the individual that was transported and any possible exposures that would be in the community? Can you walk us through that, please?
And just at a very high level, we take what is called contact tracing for folks that do have a positive test. So the state of Alaska Department of Health and Social Services, through their public health nurses, are folks that when they do have any positive case, so this has happened for each of our cases here on the Kenai Peninsula as well as around the state, they'll go through and do that contact tracing. So helping folks to essentially retrace their steps and who they may have come in contact with, what situations may potentially have caused any type of infection or vector on transmission of COVID-19, and what precautions to take. So they go through that process and try and backtrack what people have done and what their activities have been to find out if there are others that need to be contacted with a potential exposure, or any activities that would have caused the same thing. So our public health nurses do that. It is quite a lengthy and involved process, as you can imagine. If maybe you just think about retracing your steps for even a day or two, and it certainly can be a challenge as we go through our daily life. But that is what that process entails. And the public health nurses also then advise those folks on any symptoms or any changes to their health. They help monitor those things for any developments. And again, the same service for anybody they may have come in contact with. So that's contact tracing at a very high level, and that's done by our public health nurses. I also do want to point out today is a kind of a timely topic. It is Nurses Day. So we definitely want to appreciate our public health nurses that do that contact tracing, and as well as really all of our nurses and healthcare professionals every day. And this is definitely a time of year to stop and think about them as well. So happy Nurses Day to all of our nurses out there.
Indeed, happy Nurses Day to our nurses, as well as our nurses in our school district. We have a lot of nurses in our school district, and they were showcased today in a Facebook post that was provided through the school district. Dan, thank you for taking the time to walk us through several questions with regards to the topic of this individual passing in the community of Anchor Point. And definitely do want to share our condolences to the community and to the family. If we could move to questions that are being posted in the comment thread, if that's something you have time to do tonight.
I think we definitely have time, so let's talk about those things before we end up here, and we'll try and make our way through them. And might ask you to repeat yourself. Your audio is cutting out a little bit, Brenda, but we'll power through the technical difficulties here and go from there. So yeah, if we have questions, remember you can post those in the comment thread. We'll try and get to them. So I'll let you maybe hopefully get our technical difficulties straightened out here, and we'll definitely go and get some of those answered.
My apologies. I'm going to see if I've had to go old school here. And can you hear me a little better?
Yeah, I think that's coming through a little bit better, at least on my end. Okay. So let's give it a shot.
All right. With regards to some additional things in food safety, transportation, with foods from home to the grocery store, we have an individual who's asked, can you freeze them? Can you freeze your food, and will it kill or inhibit the coronavirus on packaging?
And that is definitely a good question. I will say that I do not know the answer offhand to the freezing question, whether that affects the virus. Now, I know as we've looked into other things, for instance, we've looked into the transport of mail through the Postal Service. One of the things that's been highlighted is that changes in temperatures and things is not as hospitable of an environment for a virus, essentially. But, I do not know the answer to that one, so I don't want to claim a yes or no that will work. But maybe I'll suggest we can look at the CDC website this evening, which we do have linked off our blog. We can see if they address that. But it is advisable when you are if you're bringing in groceries into the home. One of my suggestions would be, potentially to think about, where you're placing those things. If it's packaging that you can clean or disinfect, to be able to do so, and potentially wear gloves and clean those surfaces that came into contact as you're putting food away. So I know there is some good guidance on the CDC website. I just don't have that answer in front of me.
That's fine. We're going to find it, and we'll definitely put it in the comment thread. One of the other questions with regards to testing is, has there been an increase in testing in the last 2 weeks?
I don't have the numbers in front of me for testing, but we were discussing that on one of our regular calls with our hospitals, and that did come up this morning. There has been an increase, and especially in some of the other audiences that I'll call it, or populations. So, for instance, we do know that some of the healthcare procedures, surgeries and those types of things that maybe were deferred during some of this time are starting to resume. Many of our hospitals have a protocol where the patient has to be tested before going into surgery, as one of those pre-op things that sometimes we have to do. So the testing is increased, and for instance, for that use case, and certainly there is still testing being done by private providers and through our public health nurses. So there is still some concern. So the supply chain and being able to get the media, the kits, and the other things that are needed for that testing, it is still difficult. We are still trying to work through that, and supplies are still very limited. So I don't think it's been a dramatic increase in testing, but I think because of the other healthcare implications, we've seen that. And I don't have those numbers from this morning's conversation in front of me either, but just anecdotally, I can share that, yeah, in some cases, there are some increases.
Do you know why Seldovia was able to do a community-wide test?
So Seldovia had a supply through their health and wellness and the Seldovia Village Tribe of the testing kits that they were able to procure, and they had an objective of doing a kind of a snapshot in time for the community. And the Seldovia did release a news release that basically said that they did not have any positive cases from that. And I certainly was not involved in the intricacies of that decision or privy to all of it, but it is something that was an atypical case where they decided that anybody that wished to show up would be tested, even though there perhaps somebody wasn't showing symptoms. That's not consistent with guidance from the state right now. So that was something that was done, and that was fine. But remember, we are still focusing, because of that supply chain issue, on people that are showing various symptoms. And I mentioned before, but we'll bring it up again, that the cough and some of these symptoms that we've been hearing about for months now, that really has been expanded into additional symptoms. So if you have any questions on symptoms that you're experiencing, check out the website or check out any of the things we have linked as far as checking your symptoms and those questionnaires. We've got a few of those links available on kpboem.com. And if there's any indication from those, or you need some confirmation, contact your healthcare provider and talk that through with them.
And just a point of clarification, it was Seldovia Village Tribe Health and Wellness Clinic that was able to provide the testing in the village, or at the village and the city of Seldovia.
Absolutely. Yeah, I keep mentioning Seldovia, but Seldovia Village Tribe operates Seldovia Health and Wellness. So there's a lot of Seldovias in that sentence, but thanks for that clarification.
Absolutely. Another question with regards to testing: what was the rate of testing here? How many people have been tested? And how many tests are available? Kind of a three-phase question.
Yes, and again, I'll apologize on this that I don't have some of these numbers available. I think they do record the amount of tests that have occurred, and have that in our, I believe that's in our GIS hub. And Brenda, I don't know if you can pull that up real quick. I can't do that very easily here and see if we have that number. I don't have it off the top of my head. So as we talk kind of about the other questions in that, and Brenda, I'm going to ask you to repeat the other parts of that question so I get that right, if you would, please.
Certainly. How many people have been tested and how many tests are available? And I am pulling up our hub while you are speaking.
Thank you for that. So as far as how many tests are available, we do have some numbers from the hospitals that we deal with. I believe each hospital has a supply, kind of a limited supply that's sufficient for them. I don't have the numbers off the top of my head, but one of the things that we are trying to do is to get more of those testing supplies in through the state. And as you can imagine, everybody is wanting the same thing right now, which is the testing kits and the rapid testing kits. So there is, I know there's conversation this morning was there was definitely sufficient amount for doing some of those preoperative testing and able to keep up with the demand that's coming from the various healthcare providers. But I couldn't give a number of exactly how many are available at any one time. It is fairly variable as we keep trying to get things in and as those tests are consumed and being sent out. So I don't know, Brenda, if you have that number pulled up, that might also kind of influence at least how many tests have been available so far. Do you have that handy?
I'm working on it, and I apologize. It's spinning. I'm having all kinds of technical difficulties tonight. What I'd like to do, if I could, is I'll provide that information in the comment thread for folks.
All
Happy
right.
to do so.
That sounds good. We'll come back to that and do that. So, again, what I would say is, as far as testing is concerned, is there is still, definitely those supply chain issues. Nobody is overly comfortable with those types of things. As far as having an unlimited supply of testing, there is still some difficulties in that, but that is definitely something that is to keep in mind, and that the incident management teams as well as the hospitals are working on. I did get an update from one of my staff that did have things in front of me, so I will share that at least in the Central and South Peninsula Hospital, I don't have Providence's numbers. Roughly, they estimate something between 30 and 40 tests a day at each hospital. So that might give our individual a little bit of an idea of what we're seeing for tests.
And of course, we know that the governor is basing his decisions with his team of advisors as well, based on the favorable numbers of testing results that's coming back as well.
Absolutely.
If I could change subjects a bit for you tonight as we move into our wildland fire season, I know that I think it's a timely conversation as well to have tonight with regards to being firewise, and would like to take this opportunity in your closing comments to talk a little bit about what that may be, particularly when we cannot burn at this time.
Absolutely, and thanks for that. And so I don't know if my camera is picking up what a beautiful day it is outside the window behind me, but we've certainly seen some just wonderful weather here on the Kenai Peninsula. I want to start out kind of as you indicated, Brenda, with mentioning that all burn permits have been suspended as of April 1st. I'm sorry, as of May 1st. So right now there is no burning allowed on the Kenai Peninsula, with the exception of campfires, warming fires, and signaling fires. And those do have some very discrete limits on how big those can be. So in other words, things like burning of brush, burning of yard debris and things are not permitted. So there's a couple of reasons for this that the state of Alaska Forestry has decided to put these restrictions in place. First among them is, again, beautiful weather. It is very dry out there. We've had some windy days in the past few days. I see some of my trees outside my window are moving a bit as well. I've honestly not been outside too much today, so I can't tell you about the wind, but we've certainly had it over the weekend. And dry and windy conditions are just certainly not conducive to fires or are conducive with fires, depending on how you look at it. We don't want any of these types of things getting away from us or causing any issues where we need to do a bigger response. So that's part of the rationale for why these burn permits have been suspended. So let's just start out with, let me reinforce that burning is suspended on the Kenai Peninsula. And that is directly as a result of weather, but also COVID-19. We know, as we've discussed on our community conversation previously, that we still have a quarantine period for folks that are coming in from out of state, and people are still required to quarantine for 14 days. If we have a large-scale fire event in Alaska, we know that many of the firefighters and the men and women that come and help us put the fire out, many of them are from out of state, and we depend on them and the incident management teams to help our local forestry crews throughout the state put these fires out and to keep us all safe. There's a lot of unknown information and unknowns how we can handle that in the same way as we did what with having potential quarantines in effect, or are there ways that we can speed that process up? All of those things means that those resources, those men and women that actually do the hard work, are more scarce. So the best way for us to be able to handle fires like this is to not let them start in the first place. Folks on the Kenai Peninsula, I think all of you remember the Swan Lake fire, and just how many hundreds of people throughout that 3-month time frame were assigned to this fire, and many of them from crews from out of state. We may not have that luxury, and if we are able to get them up here, it may not be as quick as it was last year. So I'd like to take a moment, as we are talking about this beautiful weather. I think it is forecast to be beautiful for some time to come here, at least through the weekend. As we're thinking about getting out and recreating and doing those things, do not burn. No yard debris, no trying to burn anything. We've had several incidents, even just in the past 48 hours, where people have tried to do things or accidentally set something off, and all of a sudden it's a big deal and something that requires an immediate response. Forestry and our local fire departments and our cities are all going to do the right thing and do their best to keep those things under control if they do happen. But I would ask that each of us here on the Kenai Peninsula think about the disruption and what ended up happening with last year's fire. Recognize that we may not be able to get those folks and all those resources as quick as we did. And so let's have a very safe summer, not start any wildland fires, and be able to keep us all safe as we're still working through the COVID-19 issues.
Thank you for that, Dan. And do you have any additional last-minute closing comments before we end this evening? I'm not seeing any additional comments in the thread that couldn't be answered already by links, whether it's the testing or the fire restrictions. Before you go into that, I just had one more, and I literally said that one popped up. Can you burn in enclosed fire pits?
You can burn in fire pits, not in burn barrels. So if it's a fire for cooking or camping or warming, you can do that. And again, I don't have that right in front of me, but I want to say it has to be a maximum of 3 feet in diameter, with no more than 2-foot flame lengths. Or help me out here, Brenda. Do you have that in front of you?
You are correct. You're correct. And I just copied and pasted the link into the comment thread as well that gives the specific directions. And also, it does not limit folks from using their charcoal or gas barbecues as well.
So to sum up there, we got through that. No more than 3 feet in diameter, 2-foot flame lengths. You can use your barbecue and do those things, those commercial products, but check the links in the comments below. We'll have that for you, and you can read the full text, and also any of the questions that maybe come up that we didn't have the answers to. I think we were putting down there, or we'll have down there in short order. I don't have any other comments. I do want everybody to continue to stay safe. Think about those things. As we heard, the governor has come out with some additional phases where some more reopenings may be occurring as part of his plan. And as part of that data, and we're certainly going to link to those things. But really keep in mind that there's still a lot going on. It's a dynamic situation. Make sure you're staying safe. Make sure you are staying at least that 6 feet away from each other, and continuing to wash hands and use hand sanitizer, and make sure you're sanitizing your high touch surfaces, both at home and at work. If you're working. Wearing a mask out of doors in the public is always recommended, so please feel free to do that as well. Besides that, I don't have anything else. I certainly wish people a very great rest of the week and a good weekend, and I hope you enjoy the weather safely without burning, please, or burning responsibly. And with that, I think we'll close up if we don't have any other comments, Brenda.
We are good to go, and everyone have a good night. We will see you back here next Wednesday, unless things change, of course.
All right. Keep up to date on our social media, Facebook and Twitter, and kpboem.com. Have a great rest of your week. Good night, everybody.